Today I've got a really interesting interview to share with you, and I'm really excited that you're going to meet Dr. Melissa Lai, a senior neonatologist. I can't even say that. Her specialty is neonatology, so that's little babies who have just been born, who might be very sick. That's her job, is to care for them, to look after them, to support them into health. So she's a really interesting woman who I actually met over 18 months ago. She heard me speak at the March for Life in Queensland, and she, I think, felt a bit of, I don't want to share her story, but I think she felt a bit of a stirring on her heart to get involved in this space. And she approached me after I gave another speech later on that year in November, saying that that stirring was continuing to grow, her desire to be involved in some way. And around the same time, other medical professionals have been approaching me over the last 18 months since I've been doing what I'm doing. And so many health professionals have shared with me their deep fear of operating within a system that allows abortion up to birth, and the fact that they feel like they can't talk about it, there's no one to support them, they don't have the support of their professional peak body. I think what's really exciting is that together with Melissa as the leader, they have set up a new organisation called Prolife Health Professionals Australia, which launches today. So really exciting to see something organically spring up to support pro-life health professionals in Australia. I know organisations like this exist across the world. In America, there's the American Association of Pro-Life OBGYNs. It's got nearly 10,000 members. It's been around for, I think, 2 decades. Very credible secular medical peak body. And, you know, when Roe v. Wade was overturned, APOLOG did an amicus curiae brief to the Supreme Court and gave expert medical opinion there. So, you know, in Australia, we haven't had anything like this. A peak body purely on the abortion issue. And so I'm really excited about PHPA. I'm very impressed with Dr. Melissa Lai, and I'm really excited for you guys to meet her now. If you're not a health professional and you want to support PHPA, I'm going to put the link below so that you can sign up to the organisation as a supporter. But if you are a health professional, I'd really encourage you to spread this video amongst your networks, spread the new website amongst your networks, and get other health professionals. There's a huge strength in numbers if more people get behind this. This organisation can provide a safe harbour, but also an advocacy point for these health professionals working in this space. I hope you enjoy the video. Melissa, thank you so much for coming in. Could you tell us why you are interested in setting up an organisation, a peak body for pro-life health professionals?
Yeah, absolutely. Thanks, Jo, for having this interview. Currently in Australia, we lack a national presence and an organisation that represents pro-life health professionals. And I think in this current climate where previous health professionals who have come forward as pro-life have been vilified and made an example of, it's made people even more fearful. So we need a national organisation that is vocal and allows them to be able to practice according to their values. The other area that's really in need of attention is providing an organisation that will support health professionals that are coming up through the trainees.
And can I ask you, were you always pro-life, Mel?
Yes, in a way, but I never would envisage myself doing this kind of work, to be honest.
Yeah.
I think as medical professionals, we do what we're told.
Yeah.
That kind of gets us through medical school, and we learn by example. And I think when I came into medicine, abortions were already happening. It was part of the service that was being provided. And as a trainee, you don't question that. Where it starts to be talked about in a normal way. And even though you feel uncomfortable about that, you don't speak up because I guess you want to be part of the group.
Yeah.
You know, you want to be accepted and you want to be recognised as a competent physician. So if they're discussing, you know, providing this service as a normal part of everyday practice, it would seem quite out there to speak up against it.
I'm curious to know, what is your professional background?
Yeah, sure. So I'm a neonatologist. I'm a specialist in newborn medicine, and that's a subspecialty of paediatrics. So once you've done your residency training, if you want to do neonates, you basically do 3 years of basic pediatric training, and then you subspecialize and do another 3 years of neonatal specific training. And that's babies that are born with a medical condition where they need help. So we have intensive care nurseries around the country, as well as special care nurseries, depending on what type of care they need. The large part of what we do is looking after preterm babies. And, you know, there's 15 million preterm babies born every year. It is a huge problem. We're finding that more preterm babies are being born because of a number of different factors. They're offering resuscitation for 22-weekers.
Yeah.
And admittedly, in Australia, it's still a very new type of care that's being provided, because we really haven't had the numbers of survival to be able to advocate for that very strongly. But because more centres are providing that care at that gestation, you know, we will end up with some survivors, and then of those survivors, we'll be asking ourselves, well, how can we improve their survival? Not only survival, but also their quality of life.
Yeah.
So that's probably the bulk of what we do. And these babies and families and patients will remain in hospital for a very long time because they do have a lot of medical issues.
In 1969, when abortion was made legal for the first time in an Australian jurisdiction, it would have been unfathomable that it would have been allowed up until birth, but it now is in every state and territory. Could you tell me your perspective as a medical professional on late-term abortion?
Yeah, so it's certainly confronting as a neonatologist, to be honest, because we are providing, as I was explaining before, we're providing care for those preterm babies. You know, anything from 22 weeks now, we're considering it. We're not always providing from 22 weeks, but certainly from 23 weeks.
Okay.
In most cases, we will provide care, or we will offer care and resuscitation. So when you've got those babies being terminated for psychosocial reasons, that means they don't have a medical condition. That's tough to understand and tough to accept, to be honest.
And so when you hear the other side talk about these babies as a clump of cells, or using dehumanizing language to describe them, but then your very job is, if it's a wanted child born from 22, 23 weeks on, is to save that child's life. How does the medical profession grapple with that?
That's part of the argument. That's part of the pro-life argument, I guess, that actually it is a person. And I would say that most pro-life health professionals can't just suddenly decide it's not. And
as a neonatologist, and you've spoken about the increasing number of preterm babies that are being born, the fetus, once born, is very much a person that you treat, a patient.
100%. You know, we try and encourage them to give them a name straight away so that we can call them something.
And what are they like, these little babies? Like, they're very, very tiny. Like, I'm gesturing this, but it's more like this when they're... And you know, do they respond to the mother's voice? Do they sort of start to look around? Are they capable of feeling pain at that gestation, 23, 24, 25, 26 weeks?
Yeah, there's definitely more evidence, more and more evidence that they do feel pain, and that we should be considering that in our care. I must admit, when I first started neonatology, that wasn't a big focus, but there's more and more evidence now that we actually need to take that into consideration, because it affects long-term neurodevelopment. You know, if they're being exposed to painful procedures, you know, that's pretty much our focus of care, to try and maximise that long-term neurodevelopment.
Okay. Melissa, thank you so much for coming in. And I want to say on behalf of the many people that are watching this video, just how grateful we are for your courage as a professional woman with deep experience in the field to be stepping up in this way. And we don't know what the future's going to hold for you. It's likely to be rocky in my own professional field as an academic. You know, I've
been subject to 5 investigations, none of which have come from students or colleagues, but all from activists in the community weaponising university complaints processes against me. So I don't want to freak you out before you even start, but I do think you are tremendously courageous, and it is actually what we need. We need men and women of courage in all fields, but particularly in the health field, to step up and to support you and to be involved in this organisation. So I really do wish you all the best.
No
Thank
problem.
you.
Thanks, Jo.